I was always a bit of a nerdy kid. Was dissecting grasshoppers when I was little. I loved animals. I wanted to be a veterinarian. In college, I was a physiology major. I studied anatomy and physiology. And when I was in college, I got an opportunity to work in a laboratory that was doing research on feline viruses that cause cancer in cats. You know, there's no end to research. In veterinary care, you diagnose an animal, you fix it, they're on their way, but in research there's always more questions, and so I really wanted to be involved in that kind of a, make a hypothesis, study it, and then come to a conclusion. I went to graduate school and studied microbiology, studying viruses that cause cancer. A lot of that had to do with the fact that I had family members who had cancer. I think everybody does. And why would you not want to help that if you think you could? Well, in 2001, after September 11th, when the anthrax letters got sent out, there was a big scare. We were given a mandate to develop vaccines, diagnostics, and now we're working on other things that are coming about. Dengue fever and chikungunya is a virus that causes a lot of suffering in South America. Most of the things that we were mandated to work on have been achieved. One of the ones that was not so easy to achieve was Ebola. When the whole crisis happened in Africa, the World Health Organization was really not ready to deal with it. So we were able to put the people together to get the World Health Organization in touch with the people in our portfolio who were developing these kinds of products. And we worked a lot with the FDA, the CDC, because the CDC was in charge of deploying the medicines and administering them. And even the Department of Defense, they were very pivotal in going over to Africa and helping to stop the outbreak. And I have to say, the most beautiful orchestration of federal agencies to get all of that work done. And eventually, I think those products saved lives. The people that I know that are happiest at work are the ones who did that. They didn't go straight from college into their career. They tried different things and landed in the place, I think, because you have to be happy with what you're doing. You have to be driven and excited by it. My name is Aurigemma. I'm a microbiologist at the National Institute of Allergy and Infectious Diseases at the National Institutes of Health, and I'm proud to use my STEM background to save lives around the world.